Now I will perform the cardio exam on my patient. For the cardio exam, you're responsible for two things: listening for the valves in the appropriate locations and checking for pulses in the upper extremity and in the lower extremity bilaterally. We will first start by listening for the heart sounds. The first one that we're going to start at is the aortic valve, which is going to be located in the second intercostal space adjacent to the right sternal border. So we're going to go ahead, come here, find the clavicle, go a space below, be adjacent to the sternal border, and listen for the heart sound. Next, for the pulmonic valve, I'm going to go directly across to the left second intercostal space adjacent to the sternal border and assess for the heart sound there. Next, I will come down 1, 2 spaces to the tricuspid valve adjacent to the sternal border on the left and listen for the heart sound there. And for this next portion, I'm going to go to the fifth intercostal space in the midclavicular line here. And I was able to hear heart sounds present in all 4 locations. Again, if my patient was female, I would kindly ask for the tricuspid and mitral valve to be able to raise their left breast for me so I can better hear and assess it. The next thing I'm going to check for are the pulses. For the upper extremity, your options are the brachial pulses or the radial pulses to assess bilaterally, as you're unable to assess for the carotid bilaterally. So to do this, I'm just going to go ahead and place my fingers on the radial for the radial pulse, and it's important to remember not to use your thumb, as your thumb has a pulse, and I'm just checking to make sure that they're present, they're equal on both sides, and they are intact. The next one I'm going to check is for the Dorsalis pedis pulse. So I'm going to ask my patient to take off their shoes and socks if that's okay, because you want to make sure that you assess this entire exam on bare skin. And I'm going to then go ahead and have them flex their big toe and go medial to the hallucis longus tendon. And I feel the Dorsalis pedis pulse bilaterally, and it is intact. And that covers the cardio exam for this patient.